So today we're going to be doing a physical exam on a horse. This is Rose. She is a 15-year-old quarter horse mare. That's going to be our demonstration horse today. So when you first start doing the physical exam, the first thing that you're going to want to do is you're going to want to observe the horse from a distance. This is going to give you a chance to see what the horse is doing naturally without the stimulation of you approaching them or doing something to them. So you can look at their overall mentation, see if they are looking happy, do they have their head down, their head up, are their ears forward or to the side in a relaxed position. And then the other thing that's really good to look at is their respiratory rate. Before you start to stimulate them. So from a distance, you can watch their flank area, which is going to be right here, and watch for the expanding of this area and then the constricting of this area as they're taking a breath. A normal horse should take between 8 and 16 breaths per minute. So you can use your watch and count for 10 or 15 seconds and then multiply to get to a minute to figure out their respiratory rate. After you observe them from a distance and you're looking at their mentation and their respiratory rate, the next thing you're going to do is you're going to approach the horse, usually approaching their head. Horses are most comfortable with that. And then what I do when I'm doing a physical exam is I'm going to start at the front of the horse with their head, and then I'm going to slowly work my way back on one side. Then I'll come to the other side and do the same thing on the other side. I'm usually going to start on the horse's left side. They're more comfortable with people working on their left side, so that's usually where I start. So the first place I'm going to start when I'm actually doing the physical exam on the horse is going to be with the face. So the first thing that I'm usually going to do is I'm going to assess their nostrils and make sure that they're breathing evenly through both nostrils, and you can do that just by putting your hand on the outside and feel the air coming out. And then I'm going to lift up the horse's lip, and I'm going to look at their gum color. So a horse's gum should be sort of pale pink, and then when I run my finger over it, it should be kind of slimy, easy to slide my finger from one side to the other. And then the last thing I'm going to do while I'm in here is I'm going to do the capillary refill time. So I'm going to take my finger and I'm going to press, blanch out that area so that it's white, and then see how quickly it fills back in with the pink. Normally it should be less than 2 seconds, and that looks good. And then if Rose is willing, I can assess her tongue tone. And I can make sure that if I pull her tongue out, that then she's able to pull it back in, which she did. So after I'm finished with the mouth, then I'm going to come up and I'm going to look at her eyes. If I wanted to do a thorough eye exam, I'd use an ophthalmoscope or an indirect lens. But for the most part, I can just sort of look, see if she's got any sort of discharge coming out of either eye, see that her lids are open equally and that they're not drooping or not swollen. And then last, I'm going to check her reflexes so I can see if she can see me coming, and she'll blink. And then I'm going to see if she can feel me. I'll touch and she'll blink. And all of that looks good. As far as their ears are concerned, most horses don't like you messing with their ears, but you can sort of take your finger and run along the inside if they'll let you. Biggest problems that horses will have in their ears will be warts, and there's not a whole lot you can do about those anyway. Just want to make sure there's no growths or anything like that. Last thing on the head is going to be checking the lymph nodes. Horses have multiple lymph nodes in their head, but the two that are most easy to feel are going to be the submandibular, which is underneath the mandible here. They have a big chain, feels like little grapes under there. You want to feel for any swelling. And then back here in the throat latch area, they have the retropharyngeal lymph nodes. And you can feel here to make sure that there's no obvious swelling or anything like that. Okay, so moving backwards from the head, the next thing I'm going to assess is the horse's neck. The first thing I'm going to do is I'm going to check to make sure that their jugular vein, which runs right here in this jugular groove, is patent or still flowing. So the way to do that is to take my finger and to hold off down here and to make sure that it's filling in this space, and then when I let go, that it goes away. And then you would do that on the other side as well. And then I'm also going to check for neck mobility. So I'm going to make sure that Rose can bend to the left, that Rose can bend to the right, and that she can go up and down with no obvious pain. The next area that we're going to assess is going to be the horse's chest. And there's two key systems that we're going to look at in this area. The first one is going to be the heart. And the horse's heart, best place to hear it is going to sort of be right here behind the elbow. You can hear the heartbeat there. You can also listen for any murmurs or turbulent blood flow going on. And then after we do that, we're going to listen to the lungs. And the lungs are going to sort of form a triangle here. They're going to come down behind the scapula and then have a sort of curved arc back up here towards the flank, and then go right down there. So what I usually do is I put my stethoscope on. I'm going to listen to the heart first, and then I'm going to move from there and listen to all the different lung fields. So when you're listening to the heart, first you want to listen and make sure that you can actually hear it. It's going to be a lub-dub, lub-dub. And then I'm listening for any sort of abnormal blood flow, which is referred to as a murmur and would sound kind of like a washing machine. And then, lastly, I'm going to check my watch and I'm going to get a heart rate. So again, count for 10 or 15 seconds and then multiply to get to 60. The average horse's heart rate is 24 to 40, as long as they're not too stressed. And then from there, I'm going to listen to the different lung fields. And I'm usually going to listen in 4 distinct places. I'm going to start right here above the heart. Listen for 1 or 2 breaths, listening to the inspiration as well as the expiration. And then move up to here. Here, and lastly here. The next thing we're going to do is we're going to assess the horse's gut sounds. So the horse has a very large small intestine, large intestine sort of sitting all in here in their abdomen. The best place to listen to that or to assess it is going to be here in the flank. You're going to listen on the top quarter here, the bottom quarter here, and then the same on the other side. So normally when you're listening to gut sounds, you should be hearing movement or flow of ingesta, probably once every 5 or 10 seconds. So with your stethoscope, you're going to put that in that top quadrant and listen. And I'm not going to hear anything, and then I'm going to hear tinkle, tinkle. Movement there. And then I'm going to come down here, listen in the lower quadrant. There's some movement there. And that's going to be normal. So if you were to hear sort of tinkle, tinkle, movement, movement, tinkle, movement, tinkle, that's going to be increased gut sounds. Or if I listen for 20, 30 seconds and I don't hear anything, that's going to be decreased gut sounds. And both of those things could indicate that something was going on. Next up are the horse's limbs. You want to start at the top of each limb, run your hand down, feel for any obvious swelling or heat, coming all the way down to the foot and feeling the front of the foot for increased warmth. And then you'll always want to check the horse's digital pulses. Horses have an artery running down the inside and the outside of their leg. Right here at the back of the fetlock, you can take your thumb and your first finger and put it sort of cupped right around the back, and then you press about as firmly as you would press to feel your own pulse, and then wait to feel the pulse in those 2 arteries. You normally should be able to feel it sort of just slightly underneath your hand. If a horse has laminitis or a foot abscess or something else going on their foot, then these digital pulses are most likely going to be elevated. Last but not least, we're going to take our horse's temperature. The best way to do that is going to be rectally. When you're approaching the horse to do that, the best thing to do is to actually stand as close to them as possible. If she gets upset and tries to kick me, she's going to get a whole lot less force in her kick if I'm standing here as opposed to if I'm standing way out here. So you go in nice and close, then you're going to take your non-dominant hand, move the tail out of the way, and then using a digital thermometer, you can insert it right in the rectum, and then press the button and wait. Most of the speed read digital thermometers takes 5 to 10 seconds. I don't recommend using the mercury thermometers. They take a lot longer. And if they get dropped and broken in a stall, then you've got broken mercury that you've got to deal with. Normal horse's temperature is 99 to 101.5. If it's a little bit less than 99, I'm not a whole lot concerned. If it's over 101.5, 102, then that indicates that the horse has a fever and there's probably something else going on. So she's at 99.5 right now, and that's perfect. So that completes our physical exam. If I had picked up any abnormalities in our physical exam, then I would further pursue those, possibly by doing blood work, doing a lameness exam, doing a neurologic exam, something like that. But for today, Rose looks pretty good, so we'll turn her back out and let her enjoy the day.